Okay, the next two, 179 Main, 176 Brook, were
Oh, those were the
two
multiple pumpings.
Right.
multiple pumpings, and Kevin talked to them both.
Yeah, I spoke with both of them.
Okay.
They do acknowledge that they are having some issues,
Yep.
trying to figure out a way to get those addressed. What I said to Kathy was, technically, we would have to look at the last date of pumping where that shows that they've pumped more than 4 times in a calendar year.
Yep.
And from that point forward, they have 2 years to address their replacement.
Okay.
The only way around that is if you know, next door neighbor or somebody, you know, says that they,
Something on the lawn.
something on
or-
the lawn,
Yeah.
or, yeah, then we can accelerate the, you know, the process.
Schedule.
Yeah.
Sounds good.
But then that takes a letter from us, and then we show that they address it, and then.
So, I mean, right now, it's like, we were informed of the issues, we informed them.
Did they seem receptive to?
They know that they're having a problem.
Okay.
So you know, they both feel that they've got it manageable at this point.
And manageable being continually pumping?
Right. Well, manageable in the sense that it's, you know, it's not coming out of the ground. Maybe-
Yeah.
Maybe they get slow drains and they say, oh, man, we're gonna pump it, that kind of thing.
Okay.
Well, that's kind of, don't know
And I
about
guess
that.
this would be, after this stretch of water, would probably be when it would be its worst, right?
Mhm.
These,
Maybe.
it doesn't, they don't fix themselves.
No,
Do
they
they?
don't, no, they don't regenerate, no.
No. Funny.
Yeah, I mean, so it's gonna have to get replaced at some point,
Some
it's
point.
just,
Right,
Yeah.
and I mean, the 2 years is for replacement, right? It's not, yeah, so it's or repair, I guess, rather
yeah.
than replacement.
It'd be no different than somebody going there and failing the system.
Right.
And you know,
Still
at
have
that
2
point,
years.
you've got 2 years to replace it.
Yeah, the only reason why it
So
gets done
this-
sooner is because people are selling.
This got to the failure criteria in a different way. that's
Okay.
all.
So,
And both seem to be receptive?
Mhm.
Okay,
Yeah, they, not a lot of pushback.
all right, that's good.
Okay, next is.
I guess we'll keep getting the reports from the pumping, so.
Yes.
We'll kind of keep an eye on it in that
Yeah,
way.
you just keep an eye on the documents. So next would be 5 Palmer Road again, but it would be about
Basement,
the basement.
okay.
Did you see this?
No.
That just came in?
I
just saw an
emailed it to you.
Yeah, I saw an email.
But Kevin, I guess.
The
needs to
results of
look at
the air quality testing was done on what, September 19?
No, 10-3, wasn't it?
it. Mm,
Yeah.
Was it?
Friday, 10-3.
Yep,
Okay,
yep. And then they left some little gizmos that check for radon. They
Mhm.
had to be left for 48 hours, and then they came on the Monday and picked those up. And then very quickly afterwards, we received the report. I have talked to the town administrator about it, because she's got the report too.
yes.
I think, do you have to vote to rescind your order?
I think probably that's a good
Yeah.
idea. So both, they tested for 3 potential contaminants: asbestos, airborne mold, and radon. They found nothing on all 3, is that correct?
They got one hit on the bad black mold under the stairs. But if you remember, there was some unauthorized cleaning that had gone on before they were able to get down there.
Okay,
So my guess is perhaps whatever was down there went away.
okay,
I guess the only thing that Liz and I talked about was if you get mold because of moisture,
yeah,
then somebody, not us, but some entity of the town needs to figure out how to mitigate the moisture problem down there,
correct.
right?
Mhm.
So, you wanna leave that up to her?
Yeah, I think, so, I guess we got involved because there was a complaint of potential contamination. We assisted the town administrator in getting samples taken. At least what I read from the results is the findings were considered average, and there were no contaminants that were above
No.
the flag limits by EPA
No,
or
the
air
one-
quality.
That
Is
one
that what
small, hit for the black mold was the kind of black mold that they had found before.
Okay,
And I'm guessing it'll be the same kind of black mold they'll find again if they don't figure out how to stop the basement from being moist.
okay. So I guess, did they make recommendations in that report, or was it just findings in the
No.
report?
No,
Just
just the
findings.
findings.
Any thoughts, Kevin, on your side of what we should do? I mean, the air quality there now seems fine.
Yeah.
It doesn't seem like it's a risk for anybody to be down there, so I think we can lift the order for
Oh,
people
yeah.
to be
Yeah. think
not
so.
in the area. But to prevent future contamination, is there something we should suggest to the town administrator?
I mean, there's nothing that would indicate that you need to do additional sampling
Right,
or, regular sampling.
yeah,
So I don't think that really the board should require anything more than
Okay.
what's been done.
all right.
You
And
know, if there were a lot of hits all over the place, but they were just under
Hmm.
a standard, then I would say it should be looked at again
Sure,
in a year
Yep.
or whatever. But you're not getting any of that, so.
okay.
Just a common sense approach that mold is caused by moisture.
So if they want to, if the town wants to look at somehow mitigating
Mhm.
the moisture down there, that might be a good measure preventatively to
Yeah.
keep mold from
Yeah,
coming into that area.
and a lot of that you can do visually, in other words, if you've got, if you move forward to do something with mitigating the moisture that's in the basement, you can go down there and do the eye test,
Yeah, do I see any
Do
water?
I see any more, Especially where it was before, that's all.
And was it, I mean, I did not see it before, but was it standing water or just dampness?
I haven't been down there,
Yeah.
so I don't know.
Because it was a while back, right?
Yeah, there's something weird down there with the well and some trench and,
Well, there's a drain in the front of the building, down low, and it was 3 or 4 years ago probably, that Scott Ripley borrowed a piece of equipment from, I think it was Kingston Highway, and they were gonna try to clean that drain so that the water could drain out, that's why it's there. And that piece of equipment, whatever it was, would not do it.
Is it
wouldn't
like
do
connected to a floor drain?
Yeah, it's like a floor drain, and it goes out somewhere,
Okay.
out the front of the building, down towards the road somewhere. Nobody knows where. So it's probably gonna have to be excavated, and the pipe, I mean,
Yeah.
it could be Orangeburg pipe from 1938, for all we know.
Sure.
But it would be, I think it would be a good idea to mention that in the letter to the town, just as
They may want to investigate that
Yeah,
to
yeah.
reduce any
exactly.
standing water that accumulates in the future.
Yep, and dampness,
Okay,
to mitigate that situation down there.
all right. All right, so based on the findings, everybody's had a chance to look at that report from the air quality sampling, and hearing the health agent speak about the findings in there. Is there a motion to rescind our banning of habitation in the basement?
I make that motion. Second.
Any further discussion?
Nope.
Seeing none, all in favor?
Aye.
Aye.
Chair votes aye, motion carries. All right, so we can have that removed, and you can just send a notice to the town administrator of what we discussed for future potential remedies for any water issues.
Excellent. Next is, and you have your copies in front of you. We're starting the discussion about the fee schedule and the regulations.
Yes.
So everybody else got their copies last meeting. I was asked to find out about, it was Jared's idea for plan reviews, residential and commercial, to have commercial be a higher rate.
Yeah.
So
I
I
think that's
looked,
a good-
and our review engineer charges $170 for a commercial review. Halifax charges $170 for a commercial review. Kingston charges $250.
Okay.
So,
What does he charge for residential?
Our guy?
Our guy, yeah.
85.
Okay. So 85, and then we've got kind of like a 20% buffer for administrative costs to get us to the 100
Mhm.
fee. So if he's 170, 20% near about buffer would put us at like 200 or 225.
Yep, so you can decide what amount you would like to add to that.
Is his residential fee regardless of bedroom count?
Yes.
Okay, so it doesn't matter if you're
Doesn't
building
matter.
a 10-bedroom mansion, it's still 170.
Doesn't
Okay.
matter. And then the only other thing that was outstanding on our fee schedule was the location and sale of tobacco / nicotine delivery products. We were charging like $10. Halifax charges $50, Kingston, again, $250. So I had put down, did we want to charge $50? So.
And our tobacco inspections are currently covered under the grant, correct?
Yes.
But
At the
the administrative side of it is filing reports and what you need to do
Right.
when they do their inspections,
Yep.
so I think that's
So.
probably, 50 is probably appropriate to cover that side of it.
So if you guys agree on those two things, then I can make the changes, and then when we do have the hearing, it'll be ready.
Do other towns charge for food inspections?
Oh,
I see we have no charge on those.
Food inspections?
Yeah,
You get 2 per year that are no charge.
which is included in your annual
Cost
permit
of
fee?
permit.
Yeah.
Okay,
And then, first reinspection is no charge, but then if they have to go back.
okay,
But our food inspector also is covered under the grant at this
okay.
time.
So that seems adequate in your
Mhm.
mind? All right.
So if that's all right with you guys.
Is there a shake machine fee?
uh,
No?
I'll just have this ready.
Okay.
And then the other thing is the supplemental regs, but if you wanna take that home and pour through it and,
Yeah, I think probably not a bad idea. Do you have this as a Word document?
yeah,
Would you mind sending it to the board as a Word document? And that way we can all kind of peruse through it and make our own
they have
comments.
their
And then,
paper copies that I gave them last time.
who likes paper?
It's got in red where I think the changes should be. Very
I'm
interesting.
not really a paper guy.
I know you're not.
Not really a computer guy.
The only thing that I think is lacking is,
ADUs?
no, because Kevin said we're gonna just adopt the ADU guidance from DEP.
Okay.
Yeah, that's
Um,
fine.
Yeah.
But would be what we're running into with when someone does a Title V report, and now we require a water test. But the water test isn't coming in at the same time as the Title V report. So I would like to just kind of change the language so that they know, don't send your Title V report in until the water test is with it.
Okay.
If you have to wait a week or two, that's fine, because otherwise, then I just have piles. I got the pile over here with the water reports, I got the pile over here waiting for the water reports.
Yeah, it's incomplete.
Yes, and it is considered incomplete.
And so where do we touch on that now? Because we do, because we have the water test.
Right, so
There's our
it would
supplemental.
just throw some language in there somewhere. And then the other thing is under the second page, certificates of compliance, where we will now ask for PDF copies as well.
Yeah.
I'm still reminding everybody,
Yep.
and I'd rather just have it in the reg so I don't have to remind them, so they have to remember, if at all possible.
And do we want that, does our reviewer do electronic reviews?
Yeah.
So do we want that not just in the as-built, but also in the
Both
submission?
places.
Is it in there?
It will be,
Okay,
yeah, because I send everything to him electronically,
Perfect.
including the PDF of the plan. Makes it a lot quicker
oh yeah,
than,
and the mailing.
mailing it out
Yeah.
and getting it back,
Well, it helps save that,
yeah.
you having to drive to the post office and get
Yeah,
reimbursed for
and
postage.
cough up the money, and yeah, so it's
Okay.
working great. And, but then the other thing we talked about was shared systems, we have
Common
that
ownership,
thing about common ownership, you know, figure out like, why is it in there, and if there's anything you wanna do about that. And then you were gonna look into that other thing that always comes up during the
Yeah.
reviews.
Yeah.
So I can send everybody the word.
when do these have to be, submitted? Is it go to bylaw, not bylaws,
No, both of these things, when the board chooses to make the changes,
okay,
you can have a hearing in your Board of Health meeting.
perfect.
Yeah, but it
Okay.
has to be published
Oh, yeah, you have to go
Yeah.
through.
Yeah,
Two different
change the
weeks.
regs,
Yes.
there's-
and, before the hearing, so.
Okay.
But I think it was just something that you had talked
Yeah.
about, and we were gonna start thinking about it in September, October.
So if we, what's today? Today's the 14th, so we meet again on the 28th. If we plan to have all our changes between all of us back for the meeting on the 28th, then we could do our hearings based on the timeframes November, December, which means they could go into effect in January.
Mhm.
Be nice and clean.
Yeah, because the last ones I think are dated, I think you did them Valentine's Day.
Seems fitting.
You're probably only gonna have one meeting in December, that would be the 9th, because the second meeting would be the 23rd, and we usually don't,
Yeah, okay.
we usually bail out of that one.
So would that, if you look at the timelines for the hearing and published dates, just see if that marches out, if we
Yep,
do
I
have
will
them.
check that.
Yeah, I guess we could do, well, we'll see if it works with
Yeah.
that, if not, maybe we could do a special meeting in December to get it
Yeah,
done.
either that or you could wait till January,
Well,
no February.
Valentine's Day again?
Yeah, Valentine's Day again, that seemed to work out. You don't have to have a special meeting, you can do it in your
yeah,
Board of Health meeting.
We could do the commercial fee as $214 in honor of Valentine's Day, right?
That'd be cute.
Would that be nice?
Yeah, gets me out of it, dinner.
So next on our agenda is rat infestation at church, and I think Kevin is going to speak to that.
Ah, yes.
Very little to report. I just went over there last week. Part of the recommendations was to remove the brush pile.
Mm-hmm.
That is gone.
Oh, good.
Um,
Did it get burned, or what'd they do with it, do you know?
It was just, I didn't
Oh,
see
okay.
anything anywhere.
But it was,
It was gone.
all right,
That was all I did.
okay. Has the dumpster been brought back?
I did not see a dumpster there when I was
Okay.
there.
Because they'd asked last time, right? Or inquired about a dumpster
Yeah,
returning.
something like that, yeah.
Yeah.
And I think we were okay with that coming back, correct? As long as it was
Yeah.
type that could be secured or,
And not only that, but on what the schedule would be.
yeah.
Right, I think,
But a lot of times, those are just done as needed. You know,
Yeah.
you're not
I think
really
it was
on
every
schedule.
on
2
demand,
weeks.
yeah.
Yeah, right.
I think it's every other week is their schedule.
Mhm.
So, they do have the company that is putting out the rat bait and
Oh,
all
yeah,
that.
yes, that's right.
Right?
Yep.
So, I would assume that company will work with them to make sure that
Good,
the problem is solved.
perfect.
So, do you wanna take that off the agenda?
Do you think we need to keep it on there, or just if it pops back up, we can get it back on there?
Yep.
If Ratatouille decides to
Yeah,
cook
can
lunch
always-
again for the
Always put
daycare.
it back on. Okay, the next two addresses, 38 West, 48 Grove, are similar in that we received complaints about trash
38
and
West.
rats.
Was this on the last meeting's agenda too?
Yep. And so we did letters to both of them
That's right.
and have received no replies.
Okay.
So,
Was it just regular mail or were they
just
certified?
regular mail.
It's 38 West, okay. And then
38 West was the condition of an apartment.
Okay.
Um,
Do we have contact info for the tenant?
The tenant has left,
Okay, so it's empty right now?
yes.
Okay. Alright. Is that an apartment that was known?
Hmm?
Was an apartment known to us?
I don't believe so.
Alright. Is the septic plan on file? Does it include a, is the apartment in the main structure, or is it in the?
No,
It's in the back building?
there is a front building, there is a second barn-ish building, and then there is a third way back
Okay.
barn building. And I think it's the third way back barn building that the complainant was contacting us.
Okay.
The previous owner was a septic installer.
Oh, okay. I didn't know that. Alright.
So yeah, so we haven't heard.
Oh yeah, way back, huh?
Yeah,
Looks like there's a
Mm.
longish driveway.
yes.
What would we suggest we do with this?
Certainly give the assessors and the building department a heads up.
Yeah, that's a
Yeah,
good
that'd be
first
water, I
step.
think.
And let them
If
know.
it's going to be, if it's empty now and it's going to be rented again, can we try and get in and do a minimum housing inspection?
Oh yeah, that's what the letter says. Received a complaint about the condition of an apartment located in your property. At the earliest convenience, please contact Kevin to schedule an inspection.
Okay, what was the date of that one?
September 16th,
That was regular mail?
regular mail.
All right, do we want to send that certified this time?
Can
See
do
if we
that.
get a reply,
Yep.
and then we'll go from there.
And then the other one was
Probably be a good idea to do a joint inspection with zoning.
Zoning and
Oh,
building?
yeah,
Building.
Yeah,
that'd be good.
okay. Yeah, keep them in the loop with that
Mhm.
property.
I will.
As far as the outdoor trash at 48 Grove, was it
Yeah.
anything that was visible from the street?
Yeah,
I can go by
actually.
Okay, yeah, if you don't mind, maybe take a swing by that, and see what that property looks like. Trying to think of where it is.
It's in between Silver Lake and the train tracks.
Actually,
Oh, all right. Oh, I probably
printed it
drove
out,
by it this morning.
printed it
when I
out on
worked.
spyware.
Oh, yeah. Yeah, I would say that's
Yeah.
pretty good
But I don't
accumulation.
believe there's anybody living in there because the tax records show that the tax bills are going to Blue Castle Cayman Ltd. in Miami.
Is that like bank-owned type property?
I have no idea.
Is that where we sent that letter?
We sent that letter to the actual 48 Grove Street and we also sent it to
The-
Miami.
Okay.
If you want me to go back to Miami and.
Hand
Hand
deliver, hand
deliver.
deliver.
Right,
Miami. No, but maybe probably do the same thing.
Same thing with certified.
Do we wanna wait until you do a drive-by and then that can kinda,
Yeah,
maybe the second letter gets tailored a little
Mhm.
differently depending on what you see?
Yep.
Cause if it is visible from the street and we don't get a response, then we can go get a warrant to inspect further.
Alright, so that's that one.
And you don't think that's being lived in right now?
I don't believe so. The
Okay.
neighbor thought it was empty.
Okay. All right. That was 48 Grove?
48 Grove.
Okay.
Perk test, 76 Center Street.
that the one that gets just dropped off? Or is that the one
No.
that Joe Webby was? Joe and I spoke, he had a couple of other perk tests in town that he wanted to do first. I believe this is a perk to see if
think
it's
split the
feasible to
lot.
split the lot.
Yeah.
So, it's,
To be scheduled?
yeah.
It said 76 Center?
Yeah.
Was that the one that we had the dumping of,
No.
was that across the street? Where they were using it for like landscape debris for a while? Was that next to Harry's?
That was next to Harry.
Yeah.
Yeah.
But there's a structure still in the process of being built there now.
Mm.
Okay.
I don't think they're dumping anything more since they started that. I think it's a duplex, isn't it?
Yes.
Mhm. Yes.
Oh, yeah, okay, that's the one where they wanted two houses or something at
Mhm.
first?
Yeah, but
Yeah,
it's,
yeah.
now
Yeah, and
it's
then
one.
they get the kibosh on that, so
Yeah.
then they decided, yeah, so. So, yeah, he just wants to
That's
look
still
into
being
see.
built.
It's still being, yeah,
Yeah,
yeah, they're not on the fast track
No.
there.
no,
It is a pretty good sized lot, but I don't
yeah.
Yeah,
know, looks like it might be wet.
it's marginal. I
Yeah.
mean, they got a perk test, but they had to really work at it.
Mm. And wasn't that a huge system too, right?
Oh, yeah, it was
Yeah.
massive.
And all the land to the right of that building is really wet.
Yeah, there's like a little,
Yeah, a
Brook
little
that runs
river,
through
a
there.
little brook.
Mhm.
Right, so, under new business, food inspections.
yes.
Our food inspector is just about done doing our fall inspections. And the last two that she did is brought to my attention, and I think I sent them to you guys. This is the convenience stores,
Okay.
and they're gross.
Well, yes, I did see that. It was some expired stuff. There was some, yeah, there was a couple issues.
Yeah, I mean, gross.
Let's see which one.
So I
was it.
guess,
Oh, yeah.
when I
Yeah, some evidence of insects in a cooler, some need to clean.
Yeah, so Kathy is, who's the food inspector, she is waiting to hear back from the board as to, obviously, you're gonna want her to go back and do a follow-up to make
Yes.
sure that any of the issues that she found have been resolved.
Yep.
But then the other question is, do either of these rise to the level of increasing the inspection
Frequency,
frequency
because she does them twice a year?
twice a year?
Okay.
Yeah.
So her last, this one was September, was her last one around the March,
6 months
April?
ago.
Yeah, March,
She
April.
usually has a date on there when she's gonna re-inspect. Most of the. I think.
Follow-up date 10/8.
Yeah,
So did she, do you know if she went back out 10/8?
I haven't heard.
Okay.
So anyway, those are the two questions. is-
Kinda depends, in my opinion, kinda depends on what she sees when she does the re-inspection.
Yeah, if they're
You know,
getting
If
it,
they've done a bang
if
up
they're
job
getting
with
it, then they're getting it. If they're
Yeah.
not getting it, then we gotta go back more frequently and make sure they get it.
I mean, you know, if it's a convenience store, if it were a restaurant, you know,
Yeah,
when then I think it's different. And that would warrant doing additional inspections, but, for a convenience store, let's see what she finds when she goes back and.
All right, so I will see if I can get her re-inspection reports for the next meeting.
did they require a re-inspection last time? Do you remember, 6
I
months
don't
ago?
remember, I think I would have remembered
Okay.
if there was something like what we're seeing here.
Yeah, I don't recall it being an
No.
issue like this. It just really is housekeeping.
Exactly,
Yeah, it's
yeah.
an issue. All right. So I guess maybe we'll see what she finds and then keep that on the
Report back.
agenda for now. And we'll discuss it again.
Okay. So, do you wanna talk about Ricketts before you? No, do you care?
I got
Yeah, we can
nothing.
put
I got
mail,
nothing.
we can put mail to the end.
Okay. So,
Yeah, I saw something in
yeah,
email.
under Ricketts, it was brought to our attention by Mr. McPherson. He sent an email to register concerns with the 40B project as it relates to Title V. The current plan does not appear to indicate a reserve area, but, and he had a whole bunch of other questions. And,
Kinda hard for the board, in my opinion, to make any comment until you see a plan
right,
that's formally been filed with the Board of
Right,
Health.
to this date, there's been no application.
no,
It's
not to us.
preliminary drawings.
Right, yep.
So, the town administrator did come in and say that she had been getting a lot of email traffic where, Board of Health was mentioned an awful lot. So she did put us, onto that email chain
Mhm.
so that we could be aware. But as Kevin said, until the plan comes before this board and goes out for review.
Right, that was kinda just conceptual
Yeah,
Right.
drawings.
Now,
yeah.
the last email that Mr. Stiles sent to the town's lawyer says something about, share this information with the board's peer review engineer Greg Driscoll. So they must have a engineer.
Mhm.
So they, you know, guess they do whatever it is they wanna do. So,
Hmm.
anyway, is that the position of the board, that until,
Yeah, I think so. And you had mentioned something about the multiple wells in close proximity
The,
circumventing the public water supply.
yeah, we pretty much already gave our opinion saying,
It needs to be it needs to be
yeah,
one.
but, so I just saw things from other towns that kinda indicated that that is the direction that they went on similar projects, and the DEP, gave them that guidance.
Okay. So we really don't know if they're going in that direction until they submit again,
Mhm.
but I think that's
no, it's
probably
all conjecture until the plan comes in,
Yeah.
right?
just conceptual drawings. So, yeah, that's good. We
So
can-
what's on the town website, it lacks detail, it's just a
Yeah, I think it's
preliminary.
like a not even a bid set, but it's just a
It's just a.
The very
it's just
first
a
tier
threat
of
to the town
drawings.
is what it is.
Right.
This is what we can do.
yeah. So until somebody formally requests to build it and requests
Mhm.
if they're gonna subdivide lots or whatever they're gonna do,
Right.
we don't have anything to act upon. We gave our comments and kind of spoke about what direction we'd like to see it go when they
Right.
do submit, but we don't have anything official yet.
Mhm.
Okay,
Okay, so, no action until the proposed plan comes in.
I think that's fair.
Um, Is there anything else, Kev?
No, I don't.
Give you enough stuff to do for the next little bit with those two properties?
Yeah,
Okay.
yeah. Those two properties, perk tests.
Yeah, we'll
systems,
keep you busy.
I'm fine.
Yeah, it's always something.
That's right.
Things will freeze soon, it'll quiet down.
Yeah, right.
So, mail.
All right, you out of here?
Yep.
Thanks.
All right, thank you.
Yep. No opioid updates, no grant updates?
Hmm?
Or you wanna do those after mail? Grant and opioid? There's nothing? Okay.
No, just I have some stuff to add when Art gets to
Okay.
certain
I don't know
mail
if that's a
items.
copy, but
Hmm?
I'm not sure if that's a copy.
Mail's my favorite
Okay.
part.
Thank you, Kevin.
Great, thanks. See you later.
See you, Kevin.
You ready for mail?
Ready for mail.
Okay.
Ready as I can be.
All right, we have a letter from town council, an email from town council regarding the Ahern versus Plympton suit. Basically, he says.
Yeah, I think we talked about that during the executive session, right?
That-
Yeah, that's not for dissemination, other than the date of
The
the
next
date of.
closing argument is October 15th,
Yep,
which is tomorrow,
tomorrow,
Wow.
2 p.m.
2 PM. And we have a report, a Maven report from the Southern Plymouth County Public Health Excellence Collaborative, and we had 6.
That's why I couldn't find it, it was in there.
This was in September of this year. We had 6 COVID cases, 3 Lyme, and 6 salmonellosis. And the Babesiosis, we had 2. So. And let's see, this was another email from ourselves to the building department, and we received an application to convert a garage to an ADU at 9 Upland. And we had a Title V inspection report from this July of this year, which shows the property has a 3-bedroom system. There are no permits on file allowing the second building with an apartment to hook up to the existing septic system, nor would it have been permissible to do so, as the capacity is not there to add any additional bedrooms to the septic system. Therefore, the Board of Health will not sign off on the application to convert the garage into an ADU until the owners upgrade the septic system.
So I'll be putting that on the agenda, but basically, the owners at that address advertised for sale as a 5-bedroom
Okay.
home.
With a 3-bedroom system.
We reminded them it was a 3-bedroom system, they changed the ad. Turns out that there was a barn on the property, and the owners had turned the upstairs into an apartment without any permitting. So building is taking care of that. But what they're trying to do is to go forward to call that an ADU. But, you know, it's kind of like, we can't sign off on the ADU because there's not enough septic.
Right.
Yeah.
So basically, if the owners want to go down that road, then they're gonna have to upgrade their system. So, as I said, that will go on to the agenda.
Okay, and the next is the Southern Plymouth County Public Health Excellence Collaborative Epidemiologist Report for September 2025. And it talks about Maven and communicable diseases. It's a July, August, and September report. But it's for multiple towns, so.
Yeah, I think it shows, is that COVID going up and something else coming down?
Yeah, Lyme, RMSF, and another one going up, and another tick-borne disease, 2 other tick-borne diseases going down. So. And let's see, here's our budget report from the town accountant. And we're at 16.67% expenditure through through 10/8. So we're in good shape on the budget.
Excellent.
And okay, here's a letter to Bay State Sewage Disposal in Lakeville, and informing them of what Kathy had said earlier, that we have their Title V report, but they're not considered to be complete until general potability water test has been received.
Yeah, Bay State had an issue with doing that. Kevin did speak with them, and now they understand that it's in our supplemental regulations that if they're gonna do a Title V report, they need to do a water test.
Okay.
So there are 3 outstanding addresses that I'll be waiting for.
Okay, and we have a Septic Services LLC in Lakeville, and it's come to the attention of the Plympton Board of Health, that you're pumping septic systems in Plympton without a permit. Please contact the Board of Health. Okay, did we hear back from them?
We did, he called me today, and he does know that he needs to get a permit here, similar to every other town,
Mm-hmm.
and he just kinda fell off his plate.
Okay.
So, he's gonna be doing that, and he's gonna be catching up on whatever pump records they should have been sending to us.
Great.
But it's great because then we'll have another hauler on our list.
Excellent.
Okay. And what is this to Liz?
Oh, every year, we have to continue to agree, the
Oh,
town continues to agree to,
That MOU or,
participate.
yeah, participate in the
Yeah.
Public Health Collaborative
Excellence
Okay.
Collaborative, so, that is this year's
notification.
notification of same.
Okay. And the Massachusetts Department of Public Health Arbovirus Surveillance Program report,
Final report for the season.
yes.
oh, good.
So I just highlighted the, numbers you need to know about
Yep,
Plymouth County.
DPH found 451 West Nile virus positive mosquito samples in the 8, and there were 8 human cases, but from multiple counties. And let's see, final report. That's total, 8,700. Number of West Nile virus positive horses, 0. And number of triple E positive horses, 0. And number of other West Nile virus positive mammals, 1. And there were 7 mammal specimens tested. And there were 8 human West Nile virus cases, and there was 0 triple E cases. So,
Countywide?
Hmm?
Countywide or townwide?
Oh, countywide.
this is
Yeah,
countywide,
we didn't have
yeah.
any West Nile.
Yeah,
So, it's down to
Okay.
0.
and so you won't be getting that report again until, the spring.
Okay.
Last meeting.
And those are the, yeah, that's what you missed last meeting. So,
Okay.
and the only other change in our agenda is the absolute last item, 13 Crescent Street, which was a Title V failure.
Yeah.
Application for perk test
So they're moving
has
forward?
been submitted.
Oh, good.
And Kevin and Joe Webby are going to schedule that.
Excellent. Then everybody had a chance to read the minutes from last meeting?
Yes.
Is there a motion on those?
Make a motion, we approve the minutes from the last meeting.
Second?
Motion and a second, discussion?
None.
Hearing none, all in favor?
Aye.
Aye.
Chair votes aye, motion carries. I think that's the last thing we
That's it.
had.
That's all we have.
All right, I will accept the motion to adjourn.
Make a motion, we adjourn.
Second?
Any discussion?
No.
Hearing none, all in favor?
Aye.
Aye.
Chair votes aye. Motion to adjourn passes at 18:08 hours.